gentlemen, sorry, we're gonna start right now. Welcome to the first concurrent session. I'm very sorry for a little bit of a technical glitch here. I'm gonna briefly introduce Professor Dr. Connie Kasari. Professor Connie Kasari is from the Education Department, University of California, Los Angeles. She has done extensive research on autism treatment. Her research interest is on social, emotional, and cognitive development in atypical children, randomized controlled treatment studies of social and communication behavior in children with autism. So without wasting any more time, please join me in welcoming Professor Connie Kasari.
Let's see if this works. Okay, good. Thank you very much. I'm sorry for the sort of delay here. We've got some, it's the end of the day, computers are tired, screen is tired, and so we're having some technical difficulties, and I apologize for that bottom piece on the screen. We don't know why it's there, but we're going to go with this, so bear with us. So I want to talk today about interventions for inclusion for school-age children with ASD. And so whoops, I don't have any slides, do I? You have me. Now what happened to my slides?
Okay, there we go. There.
Okay, great. So I thought we're going to talk now very fast, very briefly, about inclusion policies from the USA that may or may not have applicability across different countries. And the experiences of children and adolescents who are in general education, mainstream education, and the need for interventions specifically on peer engagement while at school. And then I'll give you some example studies briefly. Okay, so we have increasing numbers of children with ASD who are able to go into mainstream education. The new data that just came out suggests that 50% of children that are identified have IQs in the fairly high normal range, so 85 and above, so not at the intellectually disabled level. So clearly 60 to probably 70% of our children have intact intellectual abilities and should be able to be educated with their typical peers. But the primary struggle for them is in social relationships and social engagement, both with their work at school and with their peers. And so if they fail in the mainstream education, it's likely due to social and adaptive skills rather than intellectual or academic skills. So over time, we've had this increase in the number of children who are mainstreamed or included for more than 80% of the school day. And so I want to just give you a perspective. We haven't actually seen individuals with autism yet today. So I want to show you what adults and adolescents remember back about their experiences in school. They were in general ed schools during recess. Let's see.
So for me, the playground, the point was, well, the cafeteria is hell. So you eat lunch as fast as you can to get out there as fast as you can so you can get a space to be by yourself. Get on the swing and start swinging, because while you're swinging as high as you can, one, you have rhythmic movement that's very soothing, and two, you don't have to deal with anybody.
I mean, for me, I had such a hard time in my learning and everything that I really wasn't really on the yard that much.
So you didn't even go out to play?
I tried, but it sometimes a lot of times ended in a conflict or with me, not knowing, because I don't know what the best thing was to do in certain situations.
Right.
So, like, if someone might try to be friends with me, I might not try to be friends back with them and try to, I've done something that might have seemed like I was trying to be enemies with them.
Well, when you were out on the yard, so you mostly talked with your friend, did you guys ever play any games together?
No.
No?
Very rarely.
Very rarely. If there was ever a game you played, do you remember trying?
Not really. We attempted to stay out of games as much as we can.
Why did you say, it sounds like you were trying not to play them.
Exactly.
Why is that?
I don't really know why. We weren't physical game, and I don't really like games like that.
Let's see. Okay, so, we have a lot of knowledge about children's experiences from people who are thinking back about those experiences. But we need to recognize the difference between remembering back how it was and what children are experiencing as they're going through it. So there can be differences. There can also be verbal ability differences. So let's think about, these are two boys, both who are 8 years old, both of them included full-time in a third grade classroom. Both of these children were in one of my early intervention programs and had IQs in the the low to mid 50s. So they were about half the IQ of what we would consider a typical child or average IQ. And yet in third grade, they had normal IQs in the normal range, and they were fully included. So we're going to ask them some questions that we do from the Autism Diagnostic Observation Schedule that ask about teasing and bullying and how they get along with their friends. So here's one boy.
Are there sometimes things that they do that make you mad or irritate you?
No.
No? Pretty good. Do kids ever tease you?
No.
Do you ever tease kids?
No.
Oh, okay, good.
So what do you think? Think kids tease him? His mom says kids tease him, right? So he just seems a little unaware of what's going on the playground. And here's another boy.
Were you ever teased or bullied at school?
I think so, but not really. I think so. Maybe a long time ago. Maybe, I don't know.
You don't remember?
No.
You
Yeah, no. I don't. Not even bullied. I never saw that bullied.
Do you ever try to change things so that other people won't tease you?
Yeah, but it doesn't work.
It doesn't work?
Yeah.
What have you tried?
I tried being nice to them, trying to be happy and do stuff that I'm supposed to do when bullies are bullying me or something. But it doesn't always work.
It doesn't always work?
Yeah.
Does it work sometimes?
Yeah, sometimes.
Oh, okay, good.
Okay, so he's got some strategies, right? But they're not very effective. And in fact, they're probably not what we would recommend a child to do, right? We don't want to go along with the bully. So there's two different children, both about the same IQ, both fully included. Both have had, effective early interventions, but you can see that there's a range of differences between these children. And these variability in experiences suggest that we should have interventions that are also variable, that fit their needs. And what we know to date is that most social skills interventions in the United States, at least, are these clinic-based, in the hospital or in the clinic, social skills interventions. And the goal of those interventions is to actually affect their relationships at school or in the community or in the home. But in fact, they don't generalize very well, right? So children aren't able to learn those skills. Well, they learn the skills, but they're not able to generalize them. And so that's a problem. Another problem is that we need to think about what children are telling us about their experiences. So if we're doing a didactic group intervention, we may not be individualizing it to the extent that we may need to. So we have done a number of studies now where we actually ask children in mainstream classrooms, all the typical children and the children with ASD, about who their friends are, who are their best friends, who do they hang out with, and then also who hangs out with whom on the playground. So asking about all the kids in the classroom. And from asking children, we get a lot of information, right? So we find out how connected they are to other groups in their classroom. We find out who nominates them as a friend and who they nominate as friends. And what we can derive from that information, from that questionnaire, is a map. And this is a social network map of a classroom. So it tells us which kids hang out together, how salient or connected that group is. And if you'll notice on this map, there are two little boys in the blue letters, Nicholas and Nolan, and they're isolated in that they're not consistently nominated to the same group. So they don't seem to have the same, group of friends that they hang out with. Neither of those boys have autism. The little boy in red, Sam, is a boy with autism, and he's hanging on to a friend with Ella. So he's very consistently, what we find in mainstream classrooms is that children with autism are connected sort of peripherally. They have a friend or two, or they hang on to a larger group. They're not as isolated as you might suspect. And in fact, when we do these studies, and I've now done studies with hundreds of children with autism and thousands of children, typical children in mainstream classrooms who report on their relationships, we find that some children with autism are actually popular, right? They're nuclear or popular. But the majority of children are what we would call peripheral. So our goal in intervention for children who need an intervention, obviously a popular child probably doesn't need an intervention, but a child who's peripheral is to maybe help them move into being more connected to their social groups in school. The other thing we find out from these studies is that nearly all children in primary school can identify a friend. So about 90% of children. But this drops to about 50% for adults, and so that's a concern, right? That we're having more difficulty as we age with maintaining friendships. But the reciprocity, so the ability to say, you're my friend and I'm your friend, reciprocity, is limited. So about 20 to 34% of children with ASD have a reciprocated friendship in class. But surprisingly, 60% of typical children in the class have a reciprocal friendship, right? So it's not 100%. But our children definitely are having more difficulty with that reciprocity. We also know that when we watch them on the playground, they're only engaged with the other kids about a third of the playground time. And that's different from children who are typically developing, who are engaged about 80% of the time. So when our kids are not engaged with other kids, they're either isolated or they're just watching, or they're in lower levels of play. But we know that children who are engaged with other children actually initiate and respond to interactions more. So they have more opportunities to develop social communication skills. This is really important to try to get them engaged with their peers. Okay, but it's really difficult, right? Because a lot of our children like to what we call self-isolate on the playground. They sometimes are on the, just alone or running around the yard. They might be reading on the yard, or sometimes if there's a computer lab or a library, they isolate there. And they just may rarely want to engage in games. Like that adolescent said, I don't want to play games. I'm trying to avoid playing games. So that's something we often find. So how do you intervene on this? So we did a study, a randomized controlled trial, fairly small, although by autism standards, maybe large, 60 kids, and about, maybe 800 typical kids were involved. We went to 30 different schools in Los Angeles. These were low-income public schools where children were mainstreamed. And we saw children for a very short-term intervention. Our question was, can we improve peer relationships with children in a very short period of time? 6 weeks, 12 sessions, and so that would be two sessions a week of only about 20 minutes. And we wanted to compare the prevailing notions about interventions for peer relationships. So we compared what happens if you work with an adult, so child-assisted, adult-child interaction, or if we just worked with the typical peers in the classroom. So in our child-mediated approach, we got all this good information about children. So we watched them on the playground, we got teacher report, we got the peer network information. So we had a good sense of who this child was. And we determined what the top 3 problems were. And then we worked on those problems just one at a time So we thought that this was a really good way of trying to influence what was happening on the playground. In the peer mediated, we took 3 peers who were willing to participate from the classroom, and we had the peers identify some children who had difficulty on the playground. Not just kids with autism. We didn't identify any of our children. We just asked them, are there kids on the playground who have trouble playing games or engaging with their peers? And then we helped them generate ideas about solutions. What do you do? What can we do to change this situation for those kids? So what did we learn? Well, I was surprised that if we intervened with the peers, we got a bigger change than if we worked one-on-one with the adult and the child. It's not what I hypothesized, right? We thought that we were getting the child in the context in which, we saw the issues and we could fix those issues. But in fact, anytime peers were involved, changes were made that were much larger. So that change was over 6 weeks, and it actually maintained over a 3-month follow-up. It dipped a little bit, but it was still significantly different. So involving the typical peers, made the biggest difference. And we have reasons, why that might be. So if you look at this map, you'll see that in the one corner, the first time, the child E5 was a little girl. She was isolated. When we came back in 6 weeks, she was connected to a group. And then when we came back in 3 months, and that's the bottom map, she was still connected. So that reflects the data that we found in this paper. All right, so we had compared actually, I never mentioned this, it was a 2-by-2 design. So it was child alone with the adult, or the peers alone, or the peers and the adult, or just inclusion. Now, the peers and the adult was the same effect as peers. So anytime peers were involved, we had an effect. We also found that children who got the peer-mediated interventions had more friends that nominated them as friends. They were less isolated on the playground, but they weren't more engaged. All right, they were less isolated, but not necessarily more engaged. And teachers reported that they had better social skills in the classroom. And interestingly, teachers didn't know which condition children were in. So that's a good sign that what's happening on the playground spills over into the classroom. All right. So we learned a number of things from this study. One is that teaching peers about engaging all children makes the biggest difference in social inclusion. Working directly with the child didn't seem to help as much. And even children who had a one-on-one shadow teacher did not improve more. In fact, they were the least connected, right? They weren't connected with the adult or with their peers. So it tells us a couple of things. It suggests that aides, if they're going to be a shadow teacher, need probably more training. But bottom line, that may be not the best model for increasing social inclusion of children. And even children who had a reciprocated friendship, so those kids that did have that friendship in the classroom, they were not more engaged on the playground. So it suggests that a playground environment is really a tough place for kids with autism. So why is that? It made us think about what the effects of social inclusion are on just changing child and teacher attitudes towards inclusion, right? So, involving the peers helped to change that environment on the playground. And if a child has more skills and the environment is willing to accept them, they're more likely to be able to execute those skills. But also, it suggests that we probably need to do an intervention that's directly on the playground. And this study was not. It was separated from the playground. We just tested the effects on the playground. So there are a couple of concerns, though. Teachers and parents often have concerns that inclusion is going to negatively affect learning of the typical classmates, right? Or that inclusion is so much a burden on the general ed teacher that it's just not going to work and it's not fair. And in fact, the evidence doesn't support either of those things. The evidence actually supports that there's a very positive effect on peers, especially in primary school. That typical peers are very accepting of all of our children as long as they have some strategies and somebody talks about it. All right. But teachers do need more support. And the strategies they use with ASD can be beneficial to all children. So I want to talk about one thing that we're really focusing in on, which is structure in the classroom and this ability to transition easily between activities and particularly between the classroom and the playground. So obviously schedules are really necessary for children, for transitions and for sort of being on task. And so here's just a typical classroom that we have in very low-resourced public schools in Los Angeles Unified. Los Angeles Unified, where I do most of my research, has 12,000 children with ASD. 75% of all children in the school district are Latino. 80% are on free and reduced lunch. So it's a very under-resourced school district. But you can see that in this classroom there's good structure, there's a full class schedule, there's individual schedules for children, and here's a little boy who's using his schedule and doing his rotations within the classroom, which are about 15 minutes in duration. And here they've rotated to independent work time. Those schedules help to downplay any kind of riots that might happen in the class because everybody knows where they're supposed to be and what they're supposed to do. So another issue is this transition to the playground. You can imagine that if you have a reciprocated friendship in your classroom, but you go out to the playground and it's just, you know, how playgrounds are, they're very busy, and you might lose where your friend is, or maybe you don't play the same games. And so you may need help in that transition to the play yard. So I'm going to show you another very brief video of this is transitioning to the playground with conversation. Whoops.
You may go, and I want you to have a conversation on the way about anything you want. But I want you two to have a conversation.
This
You
is
need
the
to
door
wait here.
to do. This is the door
With
to
Oliver.
do.
Going to the dino yard
It's
for
choice
choice.
time.
We're going to the dino yard for choice time, but
And then
Skylar, not you.
Then it's free play time, so we get extra time at the dino yard.
Choice time and free play are the same thing. Now you guys need to have a conversation about something and walk.
Do you want to see something funny? Do you want to see something funny? Power terminated. You know how to look it up. That's dangerous. Did you see that? Oh yeah. Wasn't that funny? Power terminated. Yeah. Every time I will. Oh, I like Iron Man. Iron Man's a great robot. That's my favorite. So cool. Yeah, Iron Man's so cool. Superman. No wait, Iron Man and Superman both can fly. I know. But Superman has more powers. What? Don't run on me.
Okay, in the interest of time, so they end up together on the playground. So we can talk later whether you think either or both of those boys have ASD. I can tell you off schedule. Okay, so one of the new studies we've done is we've taught paraprofessionals on the play yard, so the people who are watching the children on the play yard. Those are the adults supervising the children. And we give them a lot of materials because you need to give teachers and aides materials. So they have a lot of information and games and things that they can do. And what we find is that children who are paraprofessionals who learn these strategies actually use them, and children are more engaged on the playground with their peers. So the top line are schools that got the intervention, and the bottom line are schools that did not yet get the intervention. Okay, we have only a couple more minutes, and so I think I'm not going to show you these videos, but we can also think about doing social skills in schools that are more. Oh, I have 10 minutes? I don't think so. Do I? I do? Oh, okay, I'll show you the video. So this is, so we have a lot of tools that we use in schools because it's necessary, right? When you have a lot of different people that work with children. So this is just one of our public schools in Los Angeles, and you'll see somebody going in and trying to facilitate social or communication and how she fades out. And that's what's critical, is that the adult interventions are simple. They're simple, they're common sense, they're just facilitating, pulling back. Aren't they cute? So cute. All right, the other thing that we do, and I won't show you this video, but we use kind of conversation starters. A lot of times kids at lunchtime don't have anyone to talk to or don't know what to talk about, and so we have little, what we call social menus. And the typical kids in schools love these. We have many more requests for these from the typical children than we do from, anybody else. And so they have jokes on them and things to talk about and just things of starting a conversation. So it's just another tool. So what have we learned from school intervention studies? That interventions work for the large majority of children, especially these high-functioning children that are in mainstream education, especially when those interventions are delivered by experts and with some intensity. However, teachers can learn these interventions. They're usually pretty simple, and they can get really good results because they provide more consistency and greater intensity over time. And the advantage of individuals in contact with our children, those people who come in contact with them the most know them the most. They know when children actually have made changes or are not making changes, and when new interventions need to be put into place. So rather than relying on therapists, we really need to rely on parents and teachers, because that's where children spend the majority of their time. And because we can get those results with other people other than experts delivering the interventions. So thank you.
Well, that was very, very cool, very, very fast, Connie. Thank you very much. So we've got some time for question and answers.
May I begin? Thank you, Dr. Ashura. My name is Faris. I'm a lecturer at one of the university in Putrajaya. But I'm here as a parent because my third child, the son, is, he's mild on ASD. As a result, we sent him to the mainstream school. So whatever you have shared with us, I would say 95% accurate based on my observation to my own son. So my question is that we send the son to, we live in this city, I work in this city, so we send him to the school in Putrajaya, and most of the, he's now in the 3rd grade, 8 years old, and most of the schools of the elementary schools, they are mixed with the junior high schools and high schools. But of course they have different buildings and facilities, but my point lead to these questions because for the past 3-4 months, we did observe that after the school hours, before we go and pick him up from the school, so we realized that he started to mingle with the more school children from the junior high schools, which is like 5-6 years older than him. So my question, is that a cause of concern? So thank you.
Is that a cause of concern?
Yeah.
Well, I'm not sure. It could be great or it could be a cause of concern. It depends on who those junior high kids are. But usually we think of children not having friends that are too much older than themselves. Just because, the difference in age, you wonder what the friendship is based on. So, they might be more advanced in doing things that maybe your son shouldn't be doing, and they might pull him into those kind of things, so that would be a concern. On the other hand, if they share an interest, I try to find out what it is about those children that he likes. Maybe they're paying attention to him, or maybe they have a common interest, or I would try to find out from the school personnel kind of what's going on with that. So I don't know if it's a concern or not, but I would certainly watch it.
Can I ask a question? Yes? Okay. The question is about your 2012 study. And I just wanted to find out from you about the peer-mediated approach versus child-assisted approach. And my question is, actually it's 2 questions. The first was the peer-mediated approach within the classroom setting at all times with no pullouts with the peers, right? Is it within the context of the usual classroom routine? Or were there special times set for specific interventions and activities that the children were pulled out for peers and the child on the spectrum? So that's one of my questions. Do you want me to ask the second question first?
Do you want me to answer that one first?
Sure.
So I think the question is, when did those interventions take place? They actually didn't take place in the classroom because the school wouldn't let us. They didn't really want us to do intervention in the school. This was the first study that we did. And so they didn't want us to bother the school routine. So we actually had children only in intervention twice a week for about 20 minutes. And it was usually at part of the lunch or part of the recess. And then observers went to the school on the days that we weren't there for intervention to observe, to see what was going on. So that's when those took place.
So it was during lunch and recess within the school day?
Within the school day, yes. Oh yeah, it was at school.
At school, during school day. Okay, and my other question is with the child-assisted approach. Was that a one-to-one setting outside the school day in a clinical setting, or again was that during lunch and recess?
They were all done during school hours, no after school, 20 minutes, right, twice a week, for 6 weeks only.
Okay, and my last question is that with your suggestions seem to say that it's most effective if it's delivered by experts, right? But teachers can also be taught to do some of these strategies. I'm assuming in a situation where you don't have the resource to rope in the teachers to learn the skills to implement, that you could teach some paraprofessionals to do the same, correct? At different levels of effectiveness, obviously, than if it's done by experts like in the study, but are some of those interventions possible to be trained, to be developed for paraprofessionals and one-to-one aides?
Translate. You know, I think they're good strategies that anybody could use. I think if that's the question. You know, we get so much feedback that it's hard for us to understand.
sorry. We can talk to Professor Connie later on. First, thank you very much, Professor Connie, for that wonderful session. Please all give me a hand.
Thank you.